Oh, I love trains. So you said you get the bun?
It was open, right? Okay, I'm going to start with this cranial nerve intro. How many cranial nerves are there?
12. 12.
At least 4. Remember they're paired, so 24. But yeah, we'll only talk about 12. We will not talk about any secret cranial nerve zeros. Alright. Just the basic talk. Okay, cranial nerve number 1. What is it? Yeah, olfactory. It's not really on this picture though, because technically the olfactory nerves are the fibers that run through the cribriform plate. Do you remember the cribriform plate? It was a bone. It's the flat part of the ethmoid bone. Had a bunch of little holes in it. So, this picture on top does show where the cranial nerves would actually be. Okay, what's cranial nerve 2?
Optic.
Optic. Cranial nerve 3? Oculomotor. What does it do?
Moves the eye.
Move the eye. It's in the name. Cranial nerve 4.
Trochlear.
Right. Trochlear. I'm not sure I see that picture. Cranial nerve 5. Heard somebody say it.
Trigeminal.
Trigeminal. Cranial nerve 6. Adjacent. What does it do? Abducti. To the name. The names don't always help, but a lot of times they do. See, cranial nerve 7.
Facial.
Facial. 8. Vestibular cochlear. Back when I was first learning this, they called it the auditory nerve. When they changed the name, it messed up all my mnemonics. 9. Right, glossopharyngeal. 10.
Vagus.
Vagus. 11. Accessory. 12. Hypoglossal. Okay. Not only should you know the number, you should know the names. Factory, optic, motor, trochlear, trigeminal, facial, vestibular-cochlear, glossopharyngeal, vagus, accessory, hypoglossal. Okay, this comes out of the clinically oriented anatomy, which isn't the textbook for this class. I think I do have it listed, but not the primary textbook for this class, but it is the textbook for your other anatomy classes, so you should have it. This again goes through the cranial nerves, shows you their location, and gives you an idea about what they do. Okay, term up there, functional components. Another term you can use is type of fiber or fiber type. Fiber type might actually be more helpful. Functional component is what I'm used to. We have 7. In the spinal cord, you would only have 4 of them. Brainstem, got 7. Okay. There are motor or efferent ones. There are sensory ones or afferent. The G, first letter G, stands for general. If the first letter is S, that stands for special. Second letter S, somatic. Second letter V, visceral. Anything that is special is derived from the pharyngeal arches. Do you remember embryology? You didn't have embryology. Right. Pharyngeal arches are going to be neck and jaw region for the most part. If we were fishes, we would call it the branchial arches. Okay, you see branchial motor up there? That's where the branchial comes from. Okay. Branchia forms gills. Because we don't have gills, we call them pharyngeal, but it's the same area if we had gills. Okay. So we've got general, somatic, efferent. Those are going to be the nerves that go to the muscles of the tongue and the eye. You've got special visceral efferent. Those are going to be your chewing muscles, muscles of facial expression. General visceral efferent, parasympathetic. Okay, sensory A. Okay, GVE shouldn't be here because you already have it up there. What's missing? GVA is missing. Okay. GSA, general sensations from the head. Okay, face, ear. General visceral afferent. Okay, that should be an A. If you could make that change for me. General visceral afferent. General sensations from the viscera, okay, response to things like changes in pH, changes in blood pressure. Also, we include innervation of mucosal linings. Also, what gets included in there is things like stretching of the stomach. Special visceral afferent, taste and smell. Taste and smell. Special somatic afferent, seeing and hearing. Seeing and hearing. actually an organization behind the location of these. They line up in columns, so nuclei that have a similar function will line up in the same column in the brainstem. Okay, and that's what you see depicted here. Now this picture has 7, which is what we are using. There are some books, like when you take CNS, if you use the Note book, he likes to use only 6. Okay, he likes to combine our 2 somatic, or our 2 special areas. But you can see these columns with the functional component. And the nuclei. And here's some parasympathetic nuclei. They line up in the same column. So if you know where something is, you can make a pretty good guess as to what it does. Or if you know what it does, you have a pretty good idea of where to look for it. Okay. Sorry, these are sensory. On this little table, we have cranial nerves 1, 2, and 8 represented. How they get into the skull. Okay, olfactory through the cribriform plate. Optic nerve through the optic canal. Vestibulocochlear nerve through the internal acoustic meatus. Okay, location of cell bodies, olfactory cells, which are in the nasal mucosa. Ganglion cells. These are in the retina. And for the vestibulocochlear, you've got a vestibular ganglion and a cochlear ganglion. Those are going to be embedded in the petrous part of the temporal bone. Okay, petrous pyramid. Do you remember that from osteology? Questions? Okay, there are going to be other holes in the skull that other cranial nerves exit from, but these are the sensory. Okay, next I'm going to start with this brainstem one. Brainstem will include medullary stuff, but we do have a separate medullary slide. Set. Okay, the brainstem is the posterior part of the brain. It's what stays between the cerebrum, which is your big part, your forebrain, will be composed of the midbrain, the pons, and the medulla. Pons and medulla make up the hindbrain. It does not include cerebellum. Okay, cerebellum is in the same area, but it's often not included with what the brainstem is. Okay, the brainstem will contain cranial nerves 3 through 12. So 1, we said were located at the cribriform plate, so that's not going to brainstem. 2 is going to go to the thalamus, right, or come out from the thalamus. But once we get 3, 4, 5, and on, brainstem. One to the cribriform plate, 2 to the thalamus. Okay, thalamus is going to be part of the forebrain. Our brainstem is midbrain, pons, medulla. Midbrain, pons, medulla. Here's our optic nerve, chiasm, optic tract. Here's our olfactory tract. This would be pituitary gland, just so you get an idea of where we are. It might be a little hard to see some of these nerves, but this picture shows cranial nerves. It does not show 1, but you do have 2, which is labeled 2. At the midbrain, you've got cranial nerve 3. That's oculomotor. 4 is also coming out of the midbrain, but on the dorsal side, the back side, we don't see it here. It will wrap around, even though it starts at the back side, it wraps around ventrally. It would be in this little crease. If you can see it right here. If you look really, really close. That's 4. 5 is actually fairly big, about where 17 is. Comes out of the side of the pons. Here's the pons, here's the medulla. Right there is the pontomedullary junction. This is where you'll find 6, 7, and 8. Okay, 6 is most medial, most toward the center, maybe about where 15 is. 7 and 8 are going to be off to the side. I think you can see 7 there. There. Okay, these numbers aren't going to match up. What you're looking for are almost like thread-like things. I think if you have the picture yourself, you can blow it up, you can see a little bit better than what you've got going here. So, pons meets the medulla, that's 6, 7, and 8. 6, 7, and 8. Okay, there's a little bundle of fibers going down. This is called the pyramid. These are motor fibers. Okay, that's just for your information. And then there's this little bump off to the side. This is called the olive. Okay, are we good? Okay. So we did 6, 7, 8. What's next? Nine. Okay, nine's glossopharyngeal. We said this little bump here was called the olive. Right behind the olive, there's a little groove. You see that dark line? Coming out of the olive, you'll have glossopharyngeal, so 9 and 10. They come out of several roots. Oftentimes they blend together, so you want to make sure when you're naming them, make sure glossopharyngeal is a little higher than vagus. Okay, 11 accessory. Accessory classically has 2 parts, but sort of modern day we're just saying 1 part. The second part would be part of the vagus. But the major part of the accessory comes from spinal cord, from about C1 to C5. So, you hear spinal accessory, that's what they're talking about. So what you should see for spinal accessory is a little, and we don't see that here, but a little bundle of fibers coming straight up. They'll get close to the vagus, and then they'll travel with the vagus for part of the run. So that's 11. 12, hypoglossal is going to be in front of the olive, right there, in this groove. Okay, 9, 10, 11-ish was behind the olive, 12 in front of it. Behind and in front, I really mean dorsal is behind, ventral's in front. Okay, questions? Yeah. Yes. Now I'm going to go up to this medulla one. Sorry, I'm sneaking around. The medulla oblongata, that's the official name. This is what attaches to spinal cord. This is what attaches to spinal cord. Okay, it's not real big, 2.5 centimeters long, right? Between pons and spinal cord. Anteriorly or ventrally, you've got a fissure running right down the middle. Posteriorly, there's a sulcus, which is the same thing as a fissure, just not as deep. Right? So on the dorsal side, you've got a dorsal median sulcus. Both of them pretty much cut the medulla in half, left and right sides. Now when you pick up a medulla or brainstem in your hand, most of what you're seeing is going to be white matter. It's going to be fibers. Right? Nuclei are going to be little bumps interspersed within. Okay, the nuclei will be the gray matter part. There are centers, vital centers within the medulla that helps run the cardiovascular system, the respiratory system, and some of the reflexes. They will help control the autonomic nervous system. Lower half, cardiac, involuntary functions such as breathing, respiratory. There is a vomiting center there. I don't think we saw a picture of that area though. It would be on the dorsal side. It's an area called the area postrema. Vasomotor centers helps regulate autonomic nervous system. You've got nuclei there that will respond to blood pressure. Okay, a lot of writing here. The view we're looking at, this is the ventral side. Dorsal would be back here. What's marked as a pyramid, these are motor fibers that are descending down. They will cross. The area of crossover is called the cranial vexation. I think we have mentioned some of this before, the vital centers we mentioned. We divided up into a rostral and caudal part. The rostral part, that's the part going toward the pons. It opens up. It looks like an ice scoop. Right? The handle would be the caudal part. The caudal part is toward the spinal cord. Okay, caudal part is the handle. The rostral part is the scoop. But what actually happens there is brainstem and spinal cord are formed from the neural tube. Right, during development, it starts off with a tube. And what happens is part of that tube opens up to form the fourth ventricle. Right? So that's going to be the open part of the medulla, and actually it opens up into the pons. Also, it ends up being between pons, medulla on one side, cerebellum on the other. Anteriorly, right here, where the pons meets the medulla, you've got your abducens, facial, stipulocochlear. Got a big bundle of fibers. These are motor fibers, called the pyramid. There's a bump called the olive. That's going to be a relay nucleus. Behind the olive, you've got glossopharyngeal vagus, and coming up the side is your accessory. Between the pyramid and olive, you've got your hypoglossum. Right in the middle here, okay, what side did we say this was?
Posterior.
What was it? Cheap seats? Anterior or ventral side. Anterior or ventral side. Okay, so running down the middle, this little groove, this is called a sulcus, and actually you can go with fissure because it tends to be a little deep. Ventral side, ventral median. Median means right in the middle. Ventral median, sulcus or fissure. Okay, that divides it into two halves. between the pyramid and the olive, the terminology here is ventrolateral sulcus, but this is often referred to as the pre-olivary sulcus. And then behind it, where they're calling it posterolateral, another term for that would be post-olivary sulcus because it's behind the olive. Primal decussation crosses over our ventral median sulcus. Most of these motor fibers will cross over. It's around about 80%. So if you're writing with your right hand, that information actually started on the left side. Right? So we say your left brain. And if you're writing with your left hand, you're evil. The term for left-handed is sinestral, and it comes from sinister. That means it started on the right side of your brain, so we say your right brain. Okay? If you are right-handed, you are left brain, you are better at math and science. Okay? If you're left-handed, you are right brain, you're better at holistic, spiritual type stuff, art. Right? Yeah, that's a lot.
Thank God.
They used to believe that. In fact, when I was in grade school, they tried to teach us how to write with both hands so that we would be well-rounded people. That's why I'm good at everything. Yeah, that's why I can't write with either hand. But the truth is, it's a gradation. I mean, we use our different hands for different things, right? It's a gradation. There's no truth to one hand allows you to be better at music, and the other hand allows you to be better at science. It's a gradation, right? You can't use that as an excuse. Of course I can't draw a straight line. I'm left-handed, or I'm right-handed. Okay. All right, what side is this?
Posterior.
Yeah, posterior. It's nice to have help. Okay. I mentioned earlier, it looks like a scoop. Here's the scoopy part, the open part. Then here's the handle. You tend to have sensory stuff on this side. And you'll get more of that when you take neuroscience. Right? So these fibers are ascending fibers carrying sensory information. The fourth ventricle is this area right here. It comes to a little point right there. And then it would go into the the central canal. Right, central canal. This point where the fourth ventricle meets the central canal, that point is called an obex. Okay, you don't really need to know that term, it's not on your list here. Just more for your money. Get a bargain here at Life University. But it's good to know these terms, you'll hear them again. Okay, so this point is called the obex. The obex actually doesn't do anything. It's going to be the big chicken. We take measurements from it, we describe where things are in relationship to the obex. It's a convenient landmark. But we mentioned earlier that there was a center that was important for vomiting, or emesis, E-N-E-S-I-S. That's on either side of the obex. That's on either side of the obex. Okay, now on your list here, you've got a couple of structures, cranial, fascicle. Okay, this is the Latin version of it. You've got columns coming up the side. The medial column, well, you see this line right in the middle? Posterior, median, sulcus. When you go off to the side, there's a little column. That is your cranial fascicle. It will end in a bump called the cranial tubercle. That carries sensory information from the lower body. Okay. The one next to it is a cuneate fascicle. It goes to the cuneate tubercle. It carries sensory information from the upper body. Okay, then there's a third little bump. I'm skipping a little bit. There's a third little bump called the trigeminal tubercle. Here they're calling it tuber cinerea. Okay, the term tuber means bump. Think potato. The tuber. Okay, big bundle of fibers, right there at the side of our scoop. That's called the inferior cerebellar peduncle. Where does it go?
Cerebellum?
Cerebellum! Yeah, a lot of the stuff is in the name. Okay, a lot of little bumps in here. Those little bumps indicate locations of cranial nerve nuclei. So some of the ones that they list here, hypoglossal triangle for the hypoglossal nucleus, vagal triangle for the vagal nucleus. Out laterally, you've got a raised area for the vestibular nuclei called the vestibular area. I mentioned area postrema. That's the kinetic center on either side of the obex. I don't think I mentioned it by name, but we described it. And stria medullaris are little bundles of fibers that you see coming off the side. They will go into the vestibulocochlear nerve. So they're sort of helpful in finding that vestibular area where the vestibular nuclei are. Okay, this is cross section. This cross section is going to be rostral or caudal. That cross section, is that rostral part of the medulla or caudal part of the medulla?
Say it louder. Say it louder. You got it, Pace. Come on.
Come on. Trust yourself. That's the force. It's caudal. Why is it caudal? Right? Toward the spine. But also, I know it's caudal from the picture because I can see central canal. So that's going to be the closed part. If we saw fourth ventricle, that would be the rostral part. Okay, at this level, we can see the fibers from the pyramid crossing over. Cranial decussations. Our gracile fascicle and cuneate fascicle are on the dorsal side, so we said gracile was more medial, and then cuneatus was more lateral. Spinocerebellar tracts are the red and green. Okay, is this rostral or caudal? It's still caudal. I heard somebody say it's still caudal. And again, I've got central canal. This isn't quite as caudal as before, but there are a couple features we can see here. We have our gracile fascicle and cuneate fascicle. They are reaching their nuclei. So gracile nucleus are tubercle, cuneate nucleus are tubercle. Technically, the nucleus is deep. The tubercle would be the bump where the nucleus is at. We can follow these fibers. They arch over to the other side. This area of crossover is called, we refer to these fibers as internal arcuate fibers because they run through the internal part of the medulla and they form little arches, kind of. They will end up going into a bundle that they send up called the medial lemniscus. I'm not sure I see that on the picture though. It's mentioned, but I don't quite see it. Central canal, we've got a couple nuclei here. Epiglossal nucleus. Rostral or caudal? Yeah, this one's rostral because we've got fourth ventricle. Here's our pyramids. Squiggly line is the olive. Specifically, this is the inferior olivary nucleus, but it's the nucleus that creates the bump off to the side that we have been calling olive before. Got the inferior cerebellar peduncle there. Blue is medial longitudinal fasciculus. Nucleus ambiguous. It's labeled. There's two stories behind the name. One, it's hard to find, so they said it was ambiguous in location. The other was, at first they didn't know what its purpose was, so it was ambiguous in function. Now we've got all these new staining techniques, we know exactly what it does. It's the motor nucleus for neurons that go to throat muscles. glossal nucleus, that little bump on top is the epiglossal trigone. Here's your dorsal vagal nucleus. The little bump on top is your vagal trigone. Those were things we saw mentioned when we saw the gross picture, the outside picture. Vestibular nuclei are off to the side here. Okay, this is putting the three sections together. What this is doing, this picture is showing blood flow. So the light blue, anterior spinal artery. Okay, what else do you think the anterior spinal artery would supply? Anterior part of the spinal cord. Okay, pink is posterior spinal artery. Okay, what else would that supply? Posterior part of the spinal cord. Okay, now in between our pink and our blue, we've got yellow. Okay, those are going to be little tiny branches from vertebral artery. And I say little tiny branches because, theoretically, if you actually follow the vertebral artery and its branches, the anterior spinal artery and the posterior spinal artery are both branches off the vertebral artery. But the vertebral artery itself has little tiny branches that will supply right in between the dorsal and ventral side. So lateral medulla. Couple other that they mentioned that we don't see depicted here are the posterior inferior cerebellum and the anterior inferior cerebellum. But the name will tell you what they supply. Common diseases of the brainstem. A lot of it's going to be problems with the cranial nerves. And actually, we had these pictures of blood flow. A lot of brainstem issues come from vascular problems. Okay, and if you know what the different vessels supply, and you know, for instance, this is trigeminal stuff. If there's a clot in that posterior spinal artery, it's going to take out this trigeminal stuff, so you will lose feeling in the face. Right? Blue, there's a problem with the anterior spinal artery. This is your pyramid. So that means you're going to have motor problems. Okay, so changes in sensation, muscle weakness, depending on which blood vessel or what area gets affected. You may get vertigo. This would be due to what nerve? Vestibulocochlear. Coordination problems, also vestibulocochlear. Swallowing and speech difficulty, that would affect glossopharyngeal and vagus. Voice changes, vagus, puberty. Yeah, that's a vagal issue. Questions? Okay, go ahead and take a little break. Come back about 2:10.
Or just like, I just go all out with the spider. Not even.
Not, yeah.
Oh.
Finish
Okay, let's go ahead and get started. I'm going to continue with CN1 and we'll save CN2 for Thursday.
It started like 20 minutes ago. It's-
Be careful with medicine.
I follow my instructions. Yeah.
Okay, what's cranial nerve number 1? Olfactory. What does that do? Smell. Right. Okay. Now representing the olfactory nerve is actually the olfactory bulb and tract. I'm sorry, but the little red lines are off of it. So olfactory bulb, olfactory tract. We said it did not originate from the brain stem. Where did we say the nerves were actually? We go through the cribriform plate. The tract is going to go into the forebrain. It will actually separate into 3 smaller branches. One branch crosses over to the other side. One branch goes to the temporal lobe. And one branch goes to the thalamus and then up to the frontal lobe. Okay, we get that. Fiber type or the functional component is special visceral afferent. Special visceral afferent. Smell. Okay. So we said that the bulb and tract that we just looked at aren't really CN1, but they are representing CN1. The actual olfactory nerves are going to run through the cribriform plates. How many of them are there? How many? No. How many olfactory nerves? about 30.
Hmm?
Okay, about, give or take. Again, the actual olfactory nerves or the fibers passing through the cribriform plate. The cribriform plate has somewhere between, I don't know, 12 to 20 holes per side. You know, depending on the person. So it kind of depends on how many holes are there. Right, so they originate in the olfactory mucosa. Olfactory mucosa. It's a little patch up in the upper part of your nasal cavity. Yeah, it's going to be on the medial side. It'll also be on the lateral side. Here we're looking at the medial side. So these are your actual cranial nerves. They pass through the cribriform plate to the olfactory bulb. And really, that's where a lot of the action happens in the olfactory bulb. They're going to synapse on another set of neurons called nitrocells or tufted cells. And those are the output neurons. Those are the ones that are going to either the temporal lobe, crossing over to the other side, or to the thalamus, then to the frontal lobe. Okay, here's your cribriform plate. If you count the holes, that's how many cranial nerves, cranial nerve 1 there are. How many olfactory nerves? Right, so 1, 2, right? So these fibers do not reach the brainstem at all. Okay? The olfactory tract also does not reach the brainstem at all. It's going to stay in the forebrain. Okay. Clinical correlation. When you get to, this isn't clinical correlation, but when you get to your CNS, PNS, your neuroanatomy class next quarter, you should get a lot more about the olfactory nerves, their synapsing in the olfactory bulb, and where those tracts go. Okay, just for general reference though, we said one branch crosses over. Okay, the branch that crosses over helps determine the direction that odor is coming from so that you can find it. Okay, we said one branch went to the temporal lobe. The branch that goes to the temporal lobe, the part of the temporal lobe it goes to is involved with memories and emotions. So you smell a rose, you fall in love. It's that easy. You smell chocolate chip cookies, you think of grandma. Right? The part that goes to the thalamus and then to the frontal, that's how you are able to discern what it is you are smelling. Okay, so those are the three sort of major functions and the 3 branches. So most clinical problems would then be olfactory nerve is not working. You can't smell stuff or you smell things differently. A lot of things can cause a problem. How up are you on the histology? Not there. Okay. The mucous lining of the nose. The cells there are what we call pseudo-unipolar columnar, ciliated, right? I'm not going to go through all that, but the pseudo-stratified part of it makes it look like there are several layers. And what happens is because it's exposed to air and it's exposed to moisture, those cells erode away. They erode away. So you've got little tiny cells that will then grow into bigger cells and take their place. If you damage those cells, if you only damage the big ones, you might lose your sense of smell for a couple months, but it'll come back if you save the smaller cells. If you lose the big and the small cells, you know, I'm going to do an extreme example that you won't do at home. If you like snort lye, don't do that. Don't do that. Don't test this. Just trust on me. It'll damage those what we call basal cells, those replacement cells, and then you know if those replacement cells are gone, they don't get replaced. Right? So that's one way to damage the olfactory system. Others you can see here, respiratory tract infection. I'm sure you've noticed that if you've had a very bad cold, things don't smell right. Traumatic brain injury, especially ones that will affect the olfactory nerves, or temporal lobe, or frontal lobe. Subfrontal meningioma, that is a type of tumor. So we said it was the frontal lobe that helps you discern what it is that you're smelling. So that meningioma would affect that. Dementia. Another thing not listed here is called olfactory hallucinations. They tend to come from the temporal lobe, where you think you're smelling things, but they're not really there. The fancy terms. Anosmia, an means none, so total loss of smell. Hypo means less, so lesser smell. Hyper means more, so it's exaggerated. Dysosmia is things smell strange, distorted sense of smell. I mentioned olfactory hallucinations. They usually originate from temporal lobe, often associated with seizures. Okay, questions? Okay, so Thursday we do C. I will see you Thursday. It's okay, I'm a dad, I can do that. Have a good Wednesday.
Thank you.
You too.